Thanks. Hi, and welcome to Alleviate Dry Eye. I'm your host, Dr. Pam Terrio. I'm the author of the book, Alleviate Dry Eye, and also a dry eye specialist here in Shreveport, Louisiana. Today, I have a special guest with me. Zac Denning is meeting us from San Francisco, California. He is with ScienceBased Health, who makes my favorite omega supplement. And Zac is here to talk to us today about HydroEye. Hi, Zac.
Hi, Dr. Terrio. Thanks so much for having me on. Really a pleasure to be here.
Thanks for joining us. I have a few questions for you. You know that I like to advocate to my patients to use 4 steps every day to take care of their eyes. It's part of the dry eye workshop report to start that on every dry eye patient. And so we do artificial tears, lid scrubs, warm compresses, and then a dry eye supplement to help support a healthy tear film. And my favorite supplement is HydroEye. So I thought I'd bring you on today to share with my readers and listeners as to why we both love HydroEye. So let's start out with an easy one. What is HydroEye?
So HydroEye is a clinically tested supplement for dry eye support. It's really a unique formula. It contains an omega fatty acid from black currant seed oil called GLA, or gamma linolenic acid. I know that's kind of a mouthful, but GLA is this unique omega that isn't found at meaningful levels in our diet, and you can't get it from fish or flaxseed oil. But GLA has been found to help with dry eye in a number of dry eye studies, clinical studies. And GLA is the building block for a key molecule on the surface of the eye that helps kind of soothe the ocular surface and supports tear production. And when it's in the right balance with other omegas and specific nutrients, these all work together to help your body build a really nice, healthy tear film and to reduce those irritation symptoms. So, you know, those are symptoms that all of you presumably know really all too well, as do I. I'm a dry eye sufferer too. So HydroEye was actually studied in a clinical trial, just published in Cornea Journal, respected medical journal. And it looked at postmenopausal women who are amongst the most high risk or at risk for dry eye. And it found improved symptoms, lower levels of inflammation, and a smoother surface of the eyes compared to the placebo. So, you know, it's nice to have, you know, some evidence that it actually works in patients.
Yeah, that's exactly why I prescribe HydroEye to my patients, because it's scientifically backed, and we know that there are studies that work in the eye. So I love that you guys have proven scientifically that it's going to work and we're going to get a healthier tear film from it. Are there any other reasons why it's important to use HydroEye?
Well, you know, we're all aware of outside-in approaches to dry eye, right? Like, what's the one thing that every dry eye patient knows about before they come see their doctor even? It's like a lubricating drop, right?
Artificial
tears,
all
put things in, artificial tears. And when you go to your, doctor, especially an amazing dry eye doctor like Dr. Terrio, they will do other things in the office that maybe sort of heat the oil producing glands in your lids that in other ways kind of help your eyes kind of perform better. A lot of the things we do are from the outside in, but it's important to have an inside out approach as well. And so it's kind of like the two sort of meet in the middle. So you're working from the outside in, you're working from the inside out. And so by using sort of a really sort of well-studied dry eye supplement, you're essentially providing like a nutritional building block or building blocks to help your body produce that incredibly complex, delicate tri-layered coating that coats your eyes and keeps them kind of comfortable and shiny. And the nice thing about a supplement is it's natural, and it's also, supports other parts of your body. It's, omega fatty acids are good for your skin and your heart and other things.
Overall inflammation. Yeah,
exactly. So, it's a good thing to do in general, but it's kind of a nice way to kind of approach dry eye. And it's important to remember that, dry eye is progressive. It can get worse. And so working with your doctor, you can kind of stop that train, or at least slow it down and get some relief. And that's really important to do early on. And so, supplement is one part of that. It's not the only thing, but I think it's can play a key role in that.
Awesome. So how do we start using HydroEye?
Well, it's not difficult to use. It's a it's a soft gel. You swallow it with water, but like many things in life, consistency is often the key. Yeah, yeah. So it's like, if your doctor tells you to do something, you can't just like do it for the week after you visit them or whatever, or the week before your next visit. You need to stick with it. So everyone should try HydroEye for 2 months at least to start. That's because every dry eye is different and the person attached to it. We all have our own reasons for why dry eye is happening for us. And I'm a sufferer too. And so some people respond quickly, some people respond slowly, but everyone will need to start with like, artificial tears at the beginning. And then usually 3 to 5 weeks, people start sort of forgetting to put in their drops, for longer periods of time, not putting it in as many times per day or wearing their contacts longer. And usually within the first 2 months, about 85% of patients will notice some improvement. If you keep using it for longer, 3 to 4 months, it'll actually keep increasing through that time. But there's no magic bullet with dry eye. There's not one thing that you can do that's going to make it all disappear. So it's really important. There's going to be other things you may need to do, and your doctor is going to need to do along with that. So if HydroEye doesn't work for you, that happens for about 10 or 15% of people. It's covered by a 60-day money-back guarantee, satisfaction guarantee. So anyone who doesn't, feel like it's helped them, they can get their money back. We've been offering that for 20 years, and so we really stand behind it.
That's wonderful. There's no barrier to trying it. There's no risk. Do you recommend that patients eat something when they take the supplement, or does it do well without food?
Yeah, that's a good point. You should, any supplement generally, you should take it with or after a meal. And with omega fatty acids, the fat from your meal actually sort of helps you incorporate them and absorb them better. So that's always, that's always a good thing to do. Sure.
Awesome. And what would happen if we didn't use a dry eye supplement when we're suffering from dry eyes?
Well, first of all, every little thing helps. And if you suffer from dry eye, like I have in the past, you'll know that you need to grab at any tool that will help. And if you don't use, and in general, your doctor is going to recommend maybe a couple things in combination. And if you don't follow those recommendations, it's not your doctor who's going to suffer from that. It's really your sort of long-term eye health, and not taking care of dry eye, early on can lead to more problems later. So, I think of this as sort of a team sport. And, your eye doctor is with you there on the team, and you really need to kind of do your part and do whatever they're recommending, whether that's sort of using a heated eye mask or lid hygiene products to kind of clean your lids. A supplement can be part of that. All of that is really important. And so, having a doctor like you who really cares about the patient, is really addressing dry eye seriously, is really a blessing. So, you should really, kind of take advantage of that opportunity. Of course, if, for HydroEye, if you stop taking it, you'll notice that you feel worse generally. If you've been taking it for a few months. Yeah. So, that kind of tells you right there that there was a reason it was recommended.
Awesome. Well, that's wonderful. All right. So now we know HydroEye is the best omega supplement out there. It's easy to use. It's easy to get a hold of. You can find it on my website at pamterrio.com. You can find it on Zac's website at sbh.com. It can get direct shipped to you at home, and it will really be an integral part of your total dry eye treatment plan. So thanks again for joining us today, Zac, and check out the blog at www.pamterrio.com. Thanks again. Bye for now.
Thanks, Dr. Terrio. Bye-bye.
Thank you.